Low back pain is a widespread condition, affecting over 619 million people globally and standing as the leading cause of years lived with disability. It's defined as pain located below the costal margin and above the inferior gluteal fold, sometimes radiating to the legs. Most cases, about 90%, are classified as nonspecific, meaning they aren't linked to clear spinal disorder or injury. Prevalence is higher in females and increases with age, peaking around 85 years. Risk factors include obesity, depressive symptoms, heavy lifting at work, tobacco use, chronic diseases like diabetes, and previous episodes of low back pain. Acute nonspecific low back pain often resolves within 12 months, while chronic cases have a less favorable prognosis. Understanding these basics set the stage for exploring diagnosis and treatment options. Diagnosing low back pain starts with a thorough history and physical examination. Clinicians ask about symptom duration, location, triggers, and impact on daily life. They also screen for red flags, features that suggest serious conditions like cancer, infection, fracture, or cauda equina syndrome. Imaging tests such as X-rays or MRI are not routinely recommended for nonspecific low back pain, as they rarely improve outcomes and often reveal incidental findings unrelated to symptoms. Instead, imaging is reserved for cases with severe or progressive neurological deficits or signs of serious disease. Physical assessment includes checking spine symmetry, posture, range of motion, and mobility. For leg symptoms, tests like the straight leg raise help identify nerve involvement. This careful approach ensures that treatment is tailored to the patient's needs and avoids unnecessary interventions. Treatment for low back pain depends on whether it's acute or chronic. For acute nonspecific low back pain, initial management focuses on education, reassurance, and staying active. Patients are encouraged to avoid prolonged rest and continue their usual activities, including work. First-line therapies include non-pharmacological options like heat application, spinal manipulation, massage, and acupuncture, as well as medications such as NSAIDs and skeletal muscle relaxant. Chronic nonspecific low back pain requires a broader approach. Exercise of any type, psychological therapies like cognitive behavioral therapy, and multidisciplinary care are recommended. Medications are considered second-line for chronic cases. Invasive procedures and routine imaging are generally discouraged unless serious pathology is suspected. The goal is to empower patients with self-management strategies and evidence-based treatments that improve function and quality of life. Most low back pain cases are not caused by serious disease, and fluctuations in pain are common. Acute nonspecific low back pain usually improves within 6 weeks, while chronic pain may persist but can be managed effectively. Patients should be reassured that movement is safe and that maintaining normal activities is important for recovery. Education about the nature of pain, addressing misconceptions, and supporting self-management are crucial. For chronic cases, functional improvement is achievable even if pain doesn't fully resolve. Treatments should be tailored to individual needs, focusing on exercise, psychological support, and multidisciplinary approaches. By understanding these key messages, patients and clinicians can work together to reduce disability and improve quality of life.